When we first were authorised as a CCG, obviously the quality of the services that we commission was important to us. We'd spent a lot of time looking at quality of services in secondary care, but felt it was time to redress that balance and think about the quality of services that are provided in primary care. We wanted to involve all of the GP practices in that, not just from the point of view of the quality of the care that they deliver, but also the knowledge they have of the quality of services that are provided to their patients from us as commissioners. To do that, we set up a project called PCCP that was given some clinical leadership by Dr. Neil Morris, who's our medical director. And that programme has really been the tool by which we've involved practices in commissioning and also in driving quality in both primary and secondary care.
We're just entering the third year of the Practice Clinical Commissioning project in Gateshead, and I think it's a really important part of the work we do as a CCG and with practices. So in my role as a GP in Gateshead, but also medical director, I'm really committed to looking at the quality of care provided in primary care. And through this project, we've been able to identify really important pieces of work that are important to patients, but also that practices understand and they can really get involved in. So I think it's been a win-win situation. It's good for patients, it's been good for the clinical commissioning group because we can get some of our policies and our commissioning intentions in place, but also for practices, for them to understand what difference they can make. So just purely on the clinical benefits has been a great project, I think. But aside from that, it's also been a super way to break down any communication barriers between the CCG and the practices. We all feel it's a mutual project we're working on, and there's all sorts of benefits that come out of that are wider than the project and in unexpected ways that makes communication better, and we can take to practices other things we're working on or things that they have interest in as well. So overall, I think it's been a great project. We're very enthusiastic about it, and as we go around the practices this third year, we get a sense that they're really tied in and believing in it as well.
My role as a facilitator is to work with practices to engage them in the clinical commissioning group, specifically to deliver the Practice Clinical Commissioning project. So we work with groups of practices, have regular contact with them, we go and see them every month at least, and really support them so they feel part of the CCG, and also help them to deliver the quality improvements that they're trying to make as part of the project.
The role of the facilitator allows us to capture good ideas across Gateshead. We do this by learning and sharing events where all the practices come together and talk about the good work that's been done in the year.
I'm a fairly newly appointed facilitator to Gateshead CCG. Been in post just over 6 months, and what I've found is a really engaged group of people working with practices. And I think what I have experienced is the relationships that have been built up over the last 3 years, and I'm benefiting from that now by following on the work that my colleagues have done previously. And I think it's just great how the practices engage with the CCG, and we can work together to get the outcomes that we want, really.
I'm a newly appointed practice manager in the Gateshead area, and I've been very impressed with the way that practice managers and the clinical commissioning groups all work together. They've really got the patient's needs and interests at heart, and they're committed to working to make things happen.
As a locality manager working in Gateshead, one of my roles has been to work with the local carers organisations to help develop a protocol in Gateshead. The main advantage of my involvement has been that I've been able to bring a primary care perspective to that protocol, which has enabled us to ensure that it is as easy as possible for GPs to refer into the single point of contact, and it has allowed us to be able to work with carers in a much more effective way and to give them a much better quality of service.
I think one of the most rewarding aspects of being involved in this project is being able to see the real differences we've been able to make for patients. I think we've really been able to demonstrate we've delivered some improvements and real outcomes, haven't we?
Mm-hmm. I mean, NHS health checks, I think we've done over 3,000 of those, and the impact that can potentially have for patients is quite significant. I mean, you came up with some examples just earlier, didn't you?
Yeah, I mean, we've reduced the number of patients in care homes who've been admitted as emergency admissions. We've also managed to find more patients who are at risk of stroke and be able to treat them. And the practices have really been engaged in that and really keen to make that difference for patients. We've also identified even more carers in Gateshead so that they can be signposted to appropriate treatment and support for them.
I think the other one that you've really been involved in is the pulmonary rehab.
Yeah.
I think there's been over 200 people actually referred to that service. That's going to really make an impact on their individual lives as well.
So overall, there's been some real outcomes we've delivered.